It might be time to see the light in dry eye, especially Espansione's iLight low-level light therapy treatment. We're here with Dr. Giulia Coco to find out what the newest treatment for dry eye is doing in practices around the world and what it could do in yours.
I think that the real problem with dry eye disease is that with our lifestyle today, we have hundreds of millions of people affected by dry eye disease. And patients can be highly symptomatic and this can impact their quality of life. And one of the biggest challenges is that although we have several treatment options that we can offer to this patient, there is no single curative treatment. And most often we need to use multiple therapies to tackle different aspects of dry eye disease. Most of treatments start with topical pharmacotherapies or tear substitutes. It's always good to combine different strategies of treatment. For example, now there are several instrumental therapies. So the low-level light therapy, which is also called photobiomodulation, employs a light of different wavelengths, ranging from visible light to near-infrared light. It's a type of treatment that acts at cellular level. So light absorption happens within the mitochondria, within the cell. And this leads to cell photoactivation. This cell photoactivation increases the ATP production within the cell, which is basically the energy of the cell. And this increased metabolism of the cells leads to an improved and sustained cellular function over time. So basically the mechanism of action increases the work of the cells of the eyelids and the ocular surface. The low-level light therapy can be either used as a first-line treatment for a patient with dry eye disease, maybe to reduce the use of tear substitutes or other pharmacotherapies. It can also be employed in addition to other treatment or in patients that are recalcitrant to other treatment, help to boost the efficacy of other treatment and improve patient signs and symptoms. The iLight in general, it's formed by two different tools, which are the Intel's Pulse Light, the IPL, and the LLLT, so the low-level light therapy. You can use it in two different ways, and you can combine the IPL treatment with the low-level light therapy. And this happens especially in patients that have ocular rosacea. Or you can use low-level light therapy in a dry eye patient by itself, basically in any dry eye type. In fact, it has been shown that performing a session with the iLight 1 week before and 1 week after the cataract surgery help in the prevention of the onset of dry eye symptoms after surgery, meaning mostly cataract surgery and refractive surgery. In each session, the patient uses a mask like this that can be applied over the face of the patient. It's a very comfortable treatment because the patient can rest on a chair, can be reclined on a chair, needs to keep the eyes closed, and the red light is delivered over 15 minutes. After this weekly session that can be repeated for 4 weeks, then you can just follow up the patient. The treatment can be repeated as a cycle. After about 3 to 6 months, it really depends on the patient response to treatment and the outcomes that you're getting from that patient. I think that the first important thing is that the patient experience a kind of a relief immediately after the treatment. The patient can very shortly after the treatment feel that the symptoms on the ocular surface are improving. And over time, as a scientist, I prefer to speak about data taken all together because it's different when considering the single patient outcome and higher number of patients that have been treated with this type of technologies. And overall, the studies have shown that there is an improvement in the stability of the tear film, an improvement in the tear production, And of course, in all the studies, there have been a significant improvement in patient symptoms over time. I believe it's quite easy to fit this type of technology into your practice because it's a very easy treatment. With the iLight, you can treat several different types of dry eye patients. The treatment is highly tolerable from the patient, so it's completely painless. And this can improve patient satisfaction after surgery. This means that you don't need to stay with the patient while the treatment is delivered. And into your practice, it might be convenient to have a separate room in which the patient can get the treatment. There can be another person with the patient while you keep doing your clinic. There is also a portable version that the patient can use at home, and this is just to explain how easy this can be done.
With dry eye cases skyrocketing, there's never been a more pivotal time for new treatments in dry eye. Photobiomodulation with Espansione iLight has a broadening evidence base, and specialists like Dr. Giulia Coco have seen what iLight is bringing to their practice. To see what it can do for yours, head over to the Topcon or Espansione website.